Hi, everyone, and thank you for attending today's webcast on how to optimize the patient access journey with Adparo. My name is Sophia Tisdale, and I am the Director of Adparo here at Annexus Health. The goal of this webcast is to share with you how our Adparo team can help you streamline your processes, reduce the administrative burden, and increase your revenue capture for your organization. For today's agenda, we will start with who we are here at Annexus Health. We will then look at the impact of financial toxicity on patients and providers. Understand the role of access services cycle management, also referred as ASCM. Finally, we will then introduce our Adparo. Adparo is our services solution. So let's get started with Annexus Health. We will review our mission, history, and our solutions. Our mission here at Annexus Health is to utilize our innovative technology solutions, services to impact the patient journey. Within that, we have 4 goals: improve access to intended therapy, shorten time to start on therapy, maintain patients on therapy, and reduce financial toxicity for patients and providers. Let's go a little bit into our history. Our platform, AssistPoint, was created in 2014, and in 2017, Annexus Health was found and formed. Our aim is to expand for patients and providers access to care. In 2018, we focused on building our infrastructure, and we continued that into 2019 with rapid growth in product, provider organizations, and life science engagements. We aimed at improving access to care. In 2020, we secured a $10 million Series A funding, which helped us secure multiple strategic collaborations and expanded our product offerings. And we were able to add additional people to Annexus Health as well. Currently, in 2021, Annexus has surpassed $1 billion in patient financial assistance secured. We also launched our service solution, Adparo, earlier this year. We continue to expand our footprint in people, features, and products. Our solutions. At Annexus Health, we have 3 very powerful solutions that leverage technology to overcome barriers to patient access. First is AssistPoint, our cloud-based workflow solution, which helps you navigate the patient assistance journey, allowing you to search, enroll, track, and analyze. AP Analytics is a product contained within AssistPoint that provides practice with data analytics. By using AssistPoint, you're creating analytics in the background at the patient level, practice level, and management level. This is a robust resource to allow for important parts that data plays in the effective management and processes of your workflow. Over the last couple of years, we've learned that many practices just don't have the staff to do the workflow or desired additional resources to help them with financial assistance cycle management. So we launched our new part of our organization called Adparo. Adparo is our service solution which provides that help with staffing. We use expert qualified individuals to do financial assistance cycle management for access services in total, or can provide the opportunity to help with individual areas where there are challenges. Adparo utilizes our software, AssistPoint, to help the implementation of financial assistance cycle management inside the organizations, as well as filling in any gaps that a practice may need when it comes to financial assistance. So today we will learn a little bit more about how Adparo can help. The impact of financial toxicity on patients and providers. You may have heard the term financial toxicity, but what is it? What is financial toxicity? Financial toxicity describes the damaging impact of healthcare costs. In addition to the direct economic burden, the term also encompasses the unintended consequences it creates, such as barriers to necessary care, negative effects on quality of life, and the trade-offs related to non-health related necessities. Did you know up to 80% of cancer patient survivors exhaust their savings to pay for their medical bills? In addition to that, cancer patients are 2.5 times more likely to file bankruptcy. Let's learn a little bit more about financial toxicity. A health crisis is also a financial crisis. Nearly 1 in 4 adults aged between 19 and 64 had problems paying or were unable to pay their medical bills. Out-of-pocket costs continue to rise and patients struggle to afford the needed care that's needed. Financial toxicity can lead to financial toxicity for providers as well. 33% of patient obligations above $200 are sent to collections or are written off by the provider. Head over to annexushealth.com to hear some powerful patient stories. Let's learn a little bit more about the role of Access Services Cycle Management, ASCM. What is Access Services Cycle Management? ASCM refers to the comprehensive process of managing the patient access journey that includes FACM, Financial Assistance Cycle Management, and the fulfillment of services. Some of the services that are included in ASCM are benefit investigations, insurance verification, the prior authorization or appeal support that's needed, financial assistance or patient affordability, the travel, lodging, psychosocial help, free drug management, and of course, the collection and management of revenue for the practices. What is financial assistance cycle management, FACM? FACM is a component of ASCM. It refers to the processes used to facilitate the administrative functions, as in identification of financial assistance opportunities, which may include copay assistance, foundation support, and insurance premium assistance. It also encompasses the management of workflow and data, and the collection of patient assistance revenue. So ask yourself this: is ASCM part of your standard revenue cycle management process? If not, here are some questions you can ask your RCM team. Do we currently take a reactive or a proactive approach to RCM? We'll talk a little bit more about this in the upcoming slides. How are your patients affording their treatments? What adjustments are you making to reduce billables to patients? Where does your patient AR stand at? How much are you adjusting off as non-covered or charity? How many patients are you sending to collections? These are some really important questions that will help you identify if your practice is using ASCM. So let's talk a little bit about a life cycle of a patient workflow. This is typically what we see in a reactive approach at a practice, where we often see financial assistance in practices and organization comes with a reactive approach. Often, assistance is not sought out until after the patient's insurance has paid its obligation and the patient has received a large bill, and they have absolutely no way of paying. This is where step number 11 comes in on the screen, is after the statement goes out to the patient and the patient calls and says, I can't pay. Provider organizations are typically sending these patients off to a collection agency, setting them up on a small payment plan, or unfortunately, writing it off. We here at Annexus Health want all of our practices to be able to use the proactive approach with AssistPoint. What that means is as soon as that benefit is verified and that prior authorization is completed, we want our providers to log into AssistPoint to search and enroll into any and every type of patient assistance, financial assistance program that's available. This will ease the burden for the patient along with the providers so that the patient is not shocked when they receive a statement. At that time, the patient is already set up on a payment plan, or they've got financial assistance that is able to help pay for their out-of-pocket. ASCM has traditionally just been a very time-consuming, resource-intensive process. There's a lot of factors that complicate ASCM process. One of the main ones is lack of human resources. You have disparate systems, a drawn-out, inefficient fulfillment processes, along with some of these other ones that are listed here. We also see that there are tons of unhealthy dependency on free drug programs. We want to turn those patients into revenue-generating patients for your practice. But many cancer centers, institutions, are not resourced to support necessary ASCM. Staff are stretched thin as they juggle ASCM-related tasks. They're often not trained. ASCM and FACM is a very complex job, and it often falls to staff whose primary roles are not in access services, as in verifying insurance, obtaining prior authorization, or getting financial assistance. Therefore, all processes suffer. Do you have staff to fully dedicate for ASCM or FACM? If not, that's where Adparo comes in. Adparo is our access services cycle management support to help provider organizations reduce the administrative burden across the patient journey. Adparo supports your ASCM needs with our tools, our staff, and our services. We have fully trained, experienced staff with in-depth knowledge of rev cycle and financial assistance complexities to expertly perform the ASCM-related tasks. We use our single enterprise workflow platform, AssistPoint, to manage and navigate the patient access journey. Let's go a little bit into what Adparo is and how it fits into the workflow. This is a typical example of a patient workflow within a practice where a patient comes in and has their order placed. The physician will add an order in. Everything that you see with the Annexus logo is where our Adparo team can help you. So with this, our Adparo team can conduct verification, insurance benefits for you, obtain prior authorization for those treatments, use AssistPoint on behalf of your practice to manage financial assistance, along with provide a custom financial cost estimate for each treatment. This allows your front staff to be able to collect prior to services with full workflow. Once that primary payment has paid, we will then AssistPoint and Adparo step in and help with any appeals, ensure that all of the secondary claims are filed, along with transferring any non-financial assistance codes over to the patient responsibility so that statement goes out accurately. Once we receive the payments from your financial assistance programs, we will transfer that copay amount or any remaining out-of-pocket over to the patient so the claims are not aging. This is one example of how Adparo can fit into your workflow. This slide will show you all of the offerings that Adparo has. What we just went over is the Essentials Plus plan. We also have the Essentials plan, which is all of the first column. We've also got Essentials Plus plan, and as always, we do have standalone services where we can help to fill in gaps into your workflow. How Adparo can impact your organization. A couple of ways that we do that is number one, reduce the administrative burden. Our Adparo team will take over all of the benefits of AssistPoint while freeing up your staff to offer other critical tasks. Reduce patient responsibility. Our Adparo team proactively works up all patients on treatment for all patient access services as standard practice and manage each claim from end to end to make sure nothing is slipped through the crack. Increase revenue capture. Our Adparo team proactively verifies every patient's insurance benefits, obtains prior authorizations, and secures more financial assistance, along with keeping them on a watch list or a journey to ensure that once a foundation or a grant opens up, to enroll them. The Adparo difference is we have dedicated management point of contact, regular meetings to support open communication and workflow enhancement. We provide robust analytics, productivity analytics, business reviews, monthly and quarterly business updates to make sure that all parts of ASCM are working in conjunction with patient workflow and rev cycle. Many of our practices ask, what is the approximate revenue capture? We found that practices utilizing AssistPoint fully will receive anywhere from $100,000 to $200,000 per provider. Obviously, several factors come into play, such as practice productivity, is there an in-house dispensing pharmacy, the payer mix, patient population, free drug utilization, or the amount that goes off to collections and written off. We, of course, recommend using Adparo to maximize revenue capture so that we can screen and proactively work up every single patient. Thank you so much for your time today. To ask any follow-up questions or to request a demo, please visit us at annexushealth.com. Have a great rest of your day, and thank you so much. Bye-bye.